A provider's main objective is to keep patients healthy and help them manage any illness or conditions. One main responsibility of government and commercial payers is to reimburse providers for seeing and treating patients. However, typically Medicare and many other payers reimburse providers based on a fee-for-service arrangement, where payment is based on a specific codes rather than a patient's health and the severity and complexity of each unique situation. Medicare introduced Medicare Advantage, a value-based care program which uses hierarchical condition codes, or HCCs, to assign risk scores to conditions and pay for their severity annually instead of the volume of services done for a given patient. Medicare Advantage plans and even some commercial plans will now reimburse providers using these HCCs. So how does this work? There are approximately 80 categories of diagnoses classified as HCCs. These are grouped by condition, such as myocardial infarction, diabetes, and COPD, and they are approximately 10,000 diagnosis codes from ICD-10. Providers are responsible for recording the diagnoses, documenting it properly, having a care plan, and managing that care. The more of those conditions that a patient has and the more serious the condition, the higher the risk adjustment score, a measure of risk and associated payment Medicare assigns to the patient. For example, if a patient has diabetes and the patient also has heart disease, each of those conditions will have a score and they are added up to calculate the patient's overall risk, and therefore how much money to set aside for the patient each year. Let's use another example. If we have a new patient that is 70 years old, the patient has rheumatoid arthritis, COPD, atrial fibrillation, and coronary artery disease. Since this patient has multiple conditions, it is likely that a relevant HCC code exists that would qualify for a higher risk adjustment score. Most HCC solutions only help to identify a billable code. There's often little verification to see if the documentation is adequate or any analysis or free text to identify additional conditions, and making sure the doctor has a treatment plan and proper documentation for them. Using a typical HCC solution, we would find that based on the national average of $600 per patient per month, this patient has a risk score of 0.339, meaning that a typical Medicare annual reimbursement would be $2,441. This includes all medical care from specialists, any hospitalizations, everything. The reason it's so low is that so far, the only risk factor that the system is taking into account is the patient's age. Medicomp's Quippe HCC Risk Optimizer uses Diagnostic Natural Language Processing, or NLP, which identifies clinical concepts in text. Those concepts are also linked to the Medicomp's clinical data engine, as well as an HCC analysis engine, which determine the risk score and the coding. Now that the HCC analysis has detected the appropriate and billable diagnoses codes, interactions, and what should be documented for this plan year for each of the patient's problems, you can see now the risk score has gone up to 1.426 for a payment of $10,267. The Quippe HCC Risk Optimizer also suggests we may need to do some additional documentation. If we look at the rest of the encounter, there's little documentation to support the additional risk and associated HCCs. Using the Quippe HCC Risk Optimizer, we can say, for this patient, give us the relevant data for atrial fibrillation, because not only do we have to code it and capture it, we have to show proof of a documented plan. For example, as a physician, what else are you going to do about these health problems? Are you going to refer the patient to a cardiologist? Order an EKG? The documentation must reflect the plan, because if a Medicare auditor reviews the record, they're going to look at the documentation and say it's not just enough to record the code. Using Quippe HCC Risk Optimizer, we can see exactly what we did for this patient and how it impacted both the risk score and HCC coding, the plan, the tests, the therapy, and the physical exam. The magic lies in the Quippe clinical data engine that connects terminologies, diagnoses, symptoms, treatments, and codes together. HCC codes are mapped to clinically relevant concepts so that the codes will meet the documentation requirements for atrial fibrillation. It then merges it together so that the user is in complete control of the encounter at all times. This is important because if we look at atrial fibrillation in isolation, you want to see corresponding entries. We can see the specific actions taken in regards to atrial fibrillation. Now this is evidence that we have met the Medical Group Management Association says is a sufficient evidence to pass a documentation audit for this specific HCC code for atrial fibrillation by documenting what they call the MEET protocol, or Management Evaluation Assessment Treatment. So what we've shown here is all of HCC risk review tied together, using a clinical relevancy engine mapped to ICD-10, mapped to HCCs, mapped to diagnostic prompting tools, all integrated for use either at the point of care or as a reviewer after the patient leaves, or before they come in for their next visit. Quippe HCC Risk Optimizer enables better management of chronic conditions. improve patient outcomes, and the management of clinical risk for individual patients in a population. To learn more about Quippe HCC Risk Optimizer, visit www.medicomp.com/HCC.